Using a lateral flow device to test for COVID-19. Key points to the correct technique. This video will guide you through the instructions for using the lateral flow device to test for COVID-19 and some key points to ensure you use the correct technique. This video is designed for healthcare staff who are self-swabbing and testing using the lateral flow COVID-19 test. The test itself is quick to perform, but you do need to allow 30 minutes afterwards to make sure that the tests are done correctly and ensure that the results are as accurate and reliable as possible. The lateral flow device testing kit you are supplied with contains the following: 25 foil pouches containing the test cartridge, 2 bottles of buffer solution with 6 ml in each, 25 extraction tubes with attached tube caps, and 25 sterile swabs. The manufacturer's instructions for use are included in the box and are detailed and very technical. You do not need to follow these, as NHS staff will use the test in a slightly different way, which has been agreed with experts, discussed with the Medicines and Healthcare Regulatory Authority, and the manufacturer informed. This is particularly in relation to use of the test for asymptomatic people, self-administration of the test, and the use of the nasal swab inside the lower part of both nostrils. The rest of the process, for example the way the test is performed and the results are interpreted, are the same as set out in the manufacturer's instructions. There are a few things that you should be aware of before you begin for the test to be done correctly. The test itself takes about 5 minutes to perform, but you will need to wait a full 30 minutes for the final test result. For each test you will need one device, test solution, tube, cap and swab. Preparing yourself to take the test. Make sure you have a timer, such as your mobile phone, to hand. Before you start, familiarise yourself with the instructions. You should lay the kit out on a clean and dry surface after blowing your nose and washing your hands. Check that the test is not out of date and that the pouch is not damaged or the seal broken. Remove the test cartridge from the foil pouch and place it on a flat and clean surface. It is important to remember that the test must be performed immediately after removing it from the foil pouch. When unscrewing the buffer solution bottle, ensure you only remove the very top piece, as there is a dropper to help dispense the correct volume of solution into the tube. Holding the bottle vertically, dispense only 6 drops of liquid into the tube, and then place the extraction tube in a clean small container, for example an egg cup, to hold it upright. If you use too much or too little of the solution, an incorrect test result may occur. It may be easier to do the test if you can look in a mirror. Tilt your head back and insert the swab about 1.5 centimeters into one of your nostrils and rotate the swab 10 times. Carefully remove the swab from your nose and repeat it in your other nostril. Once you have removed the swab from your nose, place the tip of the swab into the tube containing the solution and swirl it for 10 seconds. Press the tip of the swab against the inside wall of the tube and squeeze the outside wall of the tube against the swab. It should not require a lot of force to do this. Now tightly place the cap onto the extraction tube. This can be a little tight, but you must ensure it is on firmly to stop any leaks. The swab specimen should be tested immediately after collection. To do this, carefully dispense only 2 drops of the specimen solution vertically into the specimen well on the device, marked S. If you add any more than 2, you may receive an inaccurate result. Do not handle or move the test device until the test is complete and ready for reading. Set a timer for 30 minutes. Most mobile phones have a timer on them. You must ensure that you read the result at 30 minutes. If you leave the test for too long, you may receive a false positive result. The letter C on the device is the control line, meaning that the test is valid. If it is not there, the test is invalid and should be repeated using a new device. The T line indicates the test result. If it is present, the test is positive. A positive test will have two lines, a C line and a T line. If the test is positive, you will need to self-isolate and contact Occupational Health Department or your line manager and arrange a PCR test. If the test is negative, dispose of the testing equipment in the domestic waste and continue your normal activity. And if the test is invalid, you will need to take the test again with a new kit. Finally, if your test is positive, you should double bag the test equipment, including the test solution, and store it safely for 72 hours before you dispose of it in the household waste, and wash your hands. You must report the result of your test, no matter what the result is, on the COVID-19 testing results portal. You can use a smartphone, a tablet device, or a computer to do this. You will need to record the lot number found on the outside of the foil pouch and the serial number, which is found on the test device under the QR code. It is important to note that you have to format the lot and serial numbers correctly, or they will not be accepted. The serial number is 1 letter followed by 8 numbers. The lot number is 1 letter followed by 7 numbers. The letter in both the serial and the lot numbers must be in uppercase or capitals. The content of this resource has been developed from the Scottish Government Standard Operating Procedure, Novel Coronavirus COVID-19 Standard Operating Procedure, Rollout of lateral flow devices for asymptomatic testing of patient-facing staff in NHS Scotland hospitals, COVID-19 assessment centres and the Scottish Ambulance Service for SARS-CoV-2, and Frequently Asked Questions Guide to Testing Healthcare Workers. Thank you for watching.